Welcome everyone. Today we're going to talk about something very important. How to be a hero in your community by helping everyone to prevent and respond to overdoses. This is a serious topic, but understanding it can make a huge difference in saving lives. You're about to learn how to be a young hero. This is what we'll be discussing today. What is fentanyl and how to recognize and respond to an overdose? Let's dive in. Fentanyl is an extremely strong man-made drug that doctors prescribe only for severe pain, like after surgery. But when fentanyl is mixed with other drugs without people knowing, it becomes very dangerous. That's why it's important to understand the risk. Let's clear up some common myths about fentanyl. Myth: just touching fentanyl can cause an overdose. Reality: fentanyl is mainly dangerous if it gets into your body, mouth, nose, or other mucous membranes, not just through your skin. Myth: naloxone or Narcan can't reverse a fentanyl overdose. Reality: naloxone can reverse fentanyl overdoses, just like other opioid overdoses. It might take more doses because fentanyl is so strong. Myth: fentanyl is only a problem for individuals who use opioids. Reality: fentanyl can be found in many different drugs, including cocaine, methamphetamines, and counterfeit prescription pills, which means anyone can be at risk of an accidental overdose. Anyone who uses drugs can be at risk of an overdose, including people who are diagnosed with substance use disorder or use drugs occasionally in a recreational setting, or who try any illegal drug for the first time, or who aren't following their doctor's instructions closely. It's important to understand that even one-time or casual use can be dangerous. Could you spot the difference? Here's a scary fact. Illicit fentanyl is often used to make fake prescription pills that look just like Adderall, OxyContin, Percocet, Xanax, and other common medicines. But these counterfeit pills are much more dangerous. Can you spot the difference? Probably not, and that's why it's so risky. Illegal drugs don't come with an ingredient list, and many of them contain deadly doses of fentanyl without people knowing. This hidden danger is why fentanyl poisoning happens. The amount of fentanyl in a fake pill or illicit drug is unpredictable, and even a tiny amount can be fatal. That's why the risk of overdose is so high. There are two types of fentanyl: pharmaceutical fentanyl, which is developed, tested, and prescribed by doctors to treat severe pain in controlled settings, like for cancer patients. And then there's illicitly manufactured fentanyl. It's made by people who aren't scientists. It's unregulated, and it's added to other drugs to make them stronger and more addictive. You can't tell the difference between the two because fentanyl has no taste or smell. But illicit fentanyl is up to 100 times stronger than morphine. In 2022, more than 109,000 people died from drug overdoses in the United States, and 75,000 of those overdoses involved fentanyl or other synthetic opioids. This is a staggering number, but understanding the risk can help prevent more lives from being lost. Do you know the signs of an overdose? They include tiny pupils, a limp body, the person can't talk, their skin, lips, or nails may turn pale, gray, or bluish, and they may have cold or clammy skin. Breathing slows down or stops, and the person may be extremely sleepy or even pass out. You may hear snoring, choking, or gurgling sounds. If you see any of these signs, it's time to act. If someone is overdosing, here is what you need to do. First, call 911. Immediately tell them someone is unresponsive. Call out their name and perform a quick sternal rub. This is a firm rub using your knuckles to the flat bone in the middle of the person's chest. If you have naloxone, use it. Try to keep the person awake and breathing. If they aren't breathing, do CPR or rescue breathing. Lay them on their side to prevent choking. Stay with them until the paramedics arrive. Make sure your household knows how to access and use naloxone and understands how Good Samaritan laws protect people who help in an emergency. Next, I want you to remember these 3 words: lay, spray, and stay. Here's how to use naloxone. Tilt the person's head back and support their head. Insert the nasal spray nozzle into their nostril and press the plunger. Wait 2 minutes if they don't wake up. Give a second dose if you have it. If they're not breathing, perform CPR until help arrives. Once they're stable, roll them onto their side in the recovery position to prevent choking. Stay with them until emergency services arrive. Here are some very important do's and don'ts during an overdose. Do call 911. Give naloxone if available. Do rescue breathing or chest compressions if necessary, and put the person in the recovery position. Do stay with them and keep them warm. Don't slap them. Don't put them in a cold bath or shower. Don't make them vomit. Don't inject them with anything like salt water or milk. Don't use ice or water to try to wake them up. It won't help. Substance use and addiction affect every part of our society, but they are preventable. Here's what you can do. Know the risk. Get involved in positive activities and build self-confidence. Visualize a happy future. Learn to say no. Surround yourself with healthy friends. Seek support from a counselor, a teacher, or a trusted adult. By making these choices, you can avoid the dangers of drugs. Trying drugs can cause problems, but it's never too late to get help. Treatment is available and serious consequences can be avoided if you make healthier decisions. Remember, negative consequences aren't always final. There is always hope and support. You can bounce back, and you can prevent further harm by seeking help early. Thank you for joining this important discussion today, and together, we can help keep our families and communities safe from the dangers of fentanyl and drug overdoses. Stay informed, stay safe, and be a young hero.